Hi, everybody. My name is Brittany Durst. I'm a board certified family nurse practitioner here in Illinois. And I thought today I would join you to talk about vitamin D, some benefits, and supplementation. And I was going to join you outside today, but unfortunately, it's a little bit cloudy and rainy here. But anyway, we'll talk about vitamin D and get started with this here. I hope you guys enjoy it and learn a little bit more. So what is vitamin D? I feel for many people, vitamin D is kind of known as a vitamin we get from the sun, thought mostly affecting bone health. Most patients I have noticed know that they get their vitamin D from their dairy products or maybe fortified cereals, but that might be as far as it goes for a lot of people. To explain vitamin D further, we get it is a steroid hormone that we do obtain mostly from exposure to the sunlight, but it can be received from our diet and supplementation. Places we might get vitamin D within our diet could be from oily fish like salmon, mackerel, herring, cod liver. That's if you're eating cod liver, good for you. If you are, keep it up. Smaller amounts of vitamin D are found in dairy products, eggs, and beef liver. As for sun exposure, it is a little bit hard for us, some of us, due to living in colder climates where you might not get most of your skin exposed while you're outside, or people that work indoors most of the daylight hours. And lifestyle preferences. Lighter skinned individuals typically need to be outside for approximately 15 to 20 minutes with about 40% of their skin exposed to absorb that vitamin D. I don't know about you, but when it's, 40 degrees out, a little breezy and windy, I don't necessarily want to be out there with 40% of my skin exposed, and I'm sure you don't either. But this time span of needing to be in the sunlight is increased for individuals who have higher concentrations of melanin in their skin. It's noted that approximately 45 to 50% of adults are deficient of vitamin D in the US. And these numbers are higher with Hispanics and African Americans within the United States also. So that includes a good population of us. So to explain the overall health benefits, over the years of studying vitamin D, researchers have unveiled many benefits of supplementing vitamin D. These benefits of vitamin D affect pregnancy, children through the elderly patients that we see. We can note that women who supplement vitamin D in their pregnancy have children who have less risk of cavities due to stronger tooth enamel, and later in life have lower risk of periodontal disease due to their mothers building them stronger genetic foundations with vitamin D. For me, I feel it's a very simple thing to know your vitamin D levels. It's something that every adult should know. In my opinion, for adults, it's a very simple blood draw that can help identify where your vitamin D levels are currently, and it's very easily monitored over time, not something that's very painful, and simple blood draw will show you that. So typically recommended daily amount of vitamin D is 400 IUs for young children up to 12 months of age. That does increase to 600 IUs daily for children one age to approximately people in their 70s. And that increases to 800 IUs daily for individuals over 70 years old, due to these individuals not getting regular sunlight exposure and having more difficulty absorbing the vitamin D. With supplementation, we can see a decrease in nutritional deficits, periodontal disease, dental caries, some forms of cancers, cardiovascular risk, diabetes, and premature death. These are just a few examples of what vitamin D can help with, but they are big examples that affect a lot of us in the United States. Another great illustration that the public has become more aware and knowledgeable about is vitamin D supplementation in relation to COVID recovery. We've seen that individuals who have taken vitamin D supplements or start with the vitamin D while they have COVID, their cellular effects are more positive, and they do have faster immune recovery, which is great. So a lot of people have started, vitamin D just because of COVID exposure or COVID positivity, and seen better recovery with that. So great for them. Overall, as providers, I feel, I want to, and a lot of good functional docs and providers, they want to help our patients sustain wellness over their lifespan, and vitamin D can definitely help with that. So I would say if you're curious about what your vitamin D level is, go find a provider that will check that for you, get it looked at, um, and see how supplementation can benefit your deficiencies, and discuss that, on a good basis with your provider, and get that going for yourself. You'll definitely see some positive benefits. So one thing you can simply do today to improve your health is get your vitamin D level checked, get that blood draw done, and review that with your provider and see how you're feeling after that. All right, thanks you guys for joining me today, and I hope you learned a little bit more about vitamin D, and good luck with everything. Have a great day. Bye-bye.